comes to explaining your symptoms, it could be very hard to communicate exactly what you're feeling to your doctor or healthcare provider. However, when it comes to getting an accurate diagnosis, the ability to communicate your symptoms to your healthcare provider is crucial. It can make the difference in getting the diagnosis right the first time, or start your journey in the long road ahead of seeing multiple healthcare providers. In this video, I will be covering the 4 crucial components of a subjective history, and I will teach you how to talk dizzy to your doctor like a pro and on your way to a recovery plan. But first, hit that subscribe button and make sure to let me know that you love the content that I'm producing so I know to continue. So when I first meet a client, the most important part of my evaluation is the subjective history, or what you're feeling and what you have to say. If together we establish a great subjective history, that leads to an accurate diagnosis, the right exercises, and plan of care so we can get your dizziness reduced and back to your active lifestyle. The first component of the subjective history is the description of your symptoms. So depending on what you're feeling, some of the descriptors might feel like you're spinning, you see the room spinning, you're lightheaded, you may see stars and feel like you're faint. The room can look warped, your eyes or vision can be bouncy when you walk, a sense of rocking, or a sense of spaciness. All of those descriptors are specific to certain diagnoses. If you can communicate or identify what those symptoms are, then that will pull me to a diagnosis. The second part of the subjective history that we would discuss is the duration. So the symptoms that you're having, how long are those occurring? Normally, I classify symptoms into seconds, minutes, and hours. There are certain diagnoses like seconds or under a minute that are more specific to BPPV or the ear crystals. Other conditions that are seconds long would be possibly with a quick turn or a movement of the head just a few seconds long. It feels like a whoosh. That's more a hypofunction kind of duration. And then you get into different conditions like minutes. That might be suggestive of a TIA or mini stroke. Other conditions that are minutes long might be visually induced dizziness depending on your environment, like 3PD, for example. Conditions that would be hours long would include 3PD, maldigibarkment, vestibular migraine, cervicogenic dizziness, or Meniere's disease. So the more information that you can gather on the duration of your symptoms and identify that leads us to different diagnoses. The third item that we would discuss would be the tempo. Is this acute, chronic, or spells? So is this a brand new attack of dizziness or vertigo? Is this something that is more chronic that you've had for 3 months or longer? Or has it progressed through the years and that might be more suggestive of a neurologic disorder? Or are you having spells where you're having bad days in a month and then you could go 2 months and then you have a few more big spells of 72 hours or 48 hours and then you're fine for 6 months and then you have another bout? Something like that would be more indicative of a Meniere's or migraines. The fourth item to keep track of is the circumstance or what provokes your symptoms. The more information that you have on what provokes your symptoms, the better your recovery is going to be and the more accurate the diagnosis will be. So, for example, I have a lot of my clients journal their symptoms. If they're dizzy, they head over to a journal and say, I got dizzy when I did X. So this way we can identify what exactly is happening during that task. So are you having dizziness when you lay in bed or roll in bed? And that can be very suggestive of BPPV. Or are you having dizziness only when you get out of bed and you feel a little faint, which would be suggestive of orthostatic hypotension or a drop in blood pressure? Are you having spells when weather fronts come through, stressful situations, or busy environments? All of those things together can tell us exactly the source of your symptoms. Make sure to download my dizziness tracker. I'll put that link in the comments below. It's completely free. You can feel free to download that, make copies, fill that out, take that to your healthcare provider, and you will be able to communicate better with your physician or healthcare provider and make sure to get you an accurate diagnosis, reduce your symptoms, and back to the quality of life that you deserve. So thanks again for tuning in, and I will see you next week with a brand new topic. And if you have not already, make sure you subscribe and hit the notification bell so you can be notified of the new weekly content that I'll be dropping every Tuesday.